Alright, hello and welcome to our video series on hip and leg. In this particular video we're going to be covering some basic anatomy and health concerns that can go wrong when various parts of the lower body start to malfunction. So onward and upward, and let's get rolling.
Going over some basic anatomy for the lower body, some muscles that you're going to want to be familiar with are some that you've heard many times before, like the glutes, the hamstrings, the quads, and some that you probably have heard less frequently, like the lateral rotators, piriformis, adductor muscles, and things along those lines. Starting from up and moving down, on the outside you have your glutes, which do a wide variety of movement for the hip. They move the leg up and back and to the side. Underneath that you have some smaller muscles called the lateral rotators, and what these do is bring the hips outward. Moving down from there, you have your hamstrings in the back, your quads in the front, and on the inside you have your adductors. The hamstrings are responsible for bending the knee, the quads for straightening the knee, and the adductors pull your feet together when your legs are apart. This moves us down to the knee, which is a very simple joint that only opens and closes, bends and straightens. It doesn't twist at all. And from there you go down through the calf, which will point the toe, and the tibialis anterior will pull the toe up. And from there you get to the ankle, and muscles along the side, the fibularis muscles, will stabilize, and you get a rotation of the ankle in many different directions, very similar to your wrist.
So we covered a lot of territory, and there are a lot of problems that can happen of the joints that we covered. So we're just going to take some of the most common issues and discuss those. The first condition we want to talk about is sciatica. Sciatica occurs when the sciatic nerve, which exits from the lumbar spine in the lower back, and that nerve travels down the leg, and when that nerve becomes pinched or inflamed or constricted by any means, whether a disc problem or muscle problem, sends shooting pain down the leg, typically either the back of the leg down through the hamstrings, or the side of the leg either to the knee or calf. Another common issue that can happen is arthritis in the hip. The hip is a very open joint and has a lot of mobility, but with time the head of the femur, which sits in the hip joint, can develop spurs or other kinds of inflammatory conditions that can lead to arthritic pain. This can be dull or achy, or also shooting in quality, typically focal at the hip. Similar to that is another thing called bursitis. Bursitis is when a fluid-filled sac around the hip joint becomes inflamed. Pain from bursitis typically involves a feeling of heat or swelling, and is usually also very focal at the hip as well. Moving down to the knee. The knee is a very simple joint in terms of motion, but there are a lot of small tendons and ligaments that attach in that area. And if these tendons or ligaments become slightly torn or frayed, as can happen with considerable athletic use, or turning or twisting the knee in a way that is not supposed to happen, you can get very sharp or shooting pain or a feeling of instability in the knee joint, which can be aggravated if the posture and gait is wrong. We'll discuss some more about that when we talk about posture of the knees later. Continuing along that same line is when you move down to the ankle, and the tendons that go around the ankle joint and the ligaments around the ankle joint, these two can become slightly torn or inflamed. This is called a sprain, and it's typically accompanied by swelling and instability of the joint and loss of range of motion. Treatment for a sprain can be protracted, and it's common to have repeat injuries, so it's very important to get that under control very quickly, similar to knee issues. The last very common issue we want to talk about is a condition called plantar fasciitis. This is a condition that happens under the bottom of the feet, where stretches of tendinous tissue called the plantar fascia constrict and get inflamed and cause often very sharp or burning or inflammatory type pain along the bottoms of the feet. This is most commonly occurs when a person gets up in the morning. They'll feel it most specifically then, but also when they start walking from a long period of sitting or not moving, and often comes with a lot of difficulty. It's found a lot in runners or people who have very tight calves as well. So thanks for sitting with us through all of that information about anatomy and basic health problems. In our next video, we're going to be discussing stretching, so hopefully you'll join us there.